So these new blood pressure guidelines, first of all, what changed?
So these guidelines were released in November by the American Heart Association and the American College of Cardiology. And what they're saying is that we are lowering the threshold for worry at this point. We are starting to watch folks who have blood pressures of 120 or above systolic, whereas previously we had called 140 and above our zone for concern and for treatment. And we're now starting to consider treatment for folks who have blood pressures over 130 systolic. So that's a big change.
What are you measuring when you're looking at blood pressure? I mean, that's kind of something people who know the numbers, they don't necessarily know what's going on.
Sure. So part of the reason we care about this is it's an indirect way of measuring stress on your heart. How hard is your heart working? And then what kind of pressures are the rest of your body seeing? We worry about blood pressure because it can increase your risk of stroke, it can increase your risk of heart failure, and it can cause kidney disease. And so if your blood pressure is very high, you can think about your kidneys are seeing very high pressure. That's damaging to your kidneys. So what we're measuring is the amount of pressure through the system in your peripheral arteries. We often take several readings to make sure we're getting an accurate one. This is a frequent problem with home blood pressure readings, is making sure that they're done appropriately. Very healthy reading at 115/70.
Very good. A lot of people may have found out they're suddenly in this high concern or higher concern category. So what do you do with people who have high blood pressure?
There are a lot of other lifestyle factors that can be modified to reduce blood pressure. If you have sleep apnea, getting it treated, reducing alcohol intake, getting more physical activity, and maintaining a healthy body weight are all things that can make a big difference.